Si kazi ni ngumu hii masomo na mtihani na kukazwa na baridi na njaa na shida mingi. Nasema pongezi. You know, for me, I'm happy because when we were campaigning, when I was running mate, watu ya magazeti na watu ya social media, they were trying to portray me as somebody who has not gone to school, somebody primitive. Until nienda ile debate nikaporomosha Kizungu wakajua mimi nimesoma. So I want to confirm today, huyu Professor Kioni, Vice Chancellor wa Kimathi University, we went to school with him from Form 1 to Form 4, from 1978 to 1981. And I must admit that he used to beat us kwa exams. Lakini sisi tumemshida kwa uongozi. So Professor Kioni is a witness that I went to school, high school. Huyu board member, huyu director, Linus Gitai can confirm I was with him at the University of Nairobi, 1985 to 1988. So wale mlikuwa mnasema sijasoma mumesikia. And governor, nilikuwa I had enrolled for a master's program in international relations with a bias to conflict management, but when the elections got very tough, nikawachana naye nikasema kwanza nitafute kiti nitasoma baadaye. Things settle down, I'll enroll for that program. Hata mimi nikae kama homa professor. I'm already feeling good in this gown. I was asking the director how we walk gracefully so that we feel like people who have gone to school. Akasema tutembee pole pole, it is graceful. Ukivaa hii gown utembee pole pole. I want to say that President William Ruto ametuma mimi na salamu. Umepokea? Umepokea? We are clear. The president is clear that we must sort out the universal health coverage so that our people are healthy and we stop these wicked harambis to raise money to pay hospital bills. So we are working on it, and our CS is here, she has said, and it is being fast-tracked, and in due course, we'll have to cover everybody so that when you go to hospital, you are treated, you give your card, it is swiped, and you go home. That is what is being worked on.
Allow me to also say that the graduates seated here today, as you enter the job market, please remember that entrepreneurs also run the world. And therefore, if you find a place, if you find something to do, do it well. If you don't find, jiandike kazi kama wale vijana wawili, lakini sio ile walisema, but kazi ambayo pia umesomea. Sina mna hiyo? Asante sana. Naibu wa Rais, nataka nichukue nafasi hii kukualika wewe uje uongee na graduates wa hapa Outspan Medical Training College pamoja na wenyeji wa Nyeri County. Let us all be upstanding for His Excellency, the Deputy President, Honorable Riggy Gachagua. Thank you.
Sandy, thank you very much. Please be seated. Chairman and Executive Director, Outspan Hospital and Medical College, Dr. Godfrey Kiruhe, the Board of Directors, the Principal, Deputy Principals, the Governor of Nyeri County, Members of Parliament, parents, relatives and guardians, graduates, ladies and gentlemen. It is with great pleasure that I address the 11th graduation of the Auspan Medical College. Today, we confirm and witness conferment of certificates and diplomas to 353 graduates who have devoted the last few years to gaining skills in this profession. Serving in the medical profession, as you all know, is a calling. I'm sized of the hard work and sacrifice that has gone into the Auspan Medical College from its humble beginning in 2009. You have graduated over 2,800 students. This is no mean feat. Honorable guests, ladies and gentlemen, I want to take this opportunity to all the graduates to say congratulations. In line with the graduation theme, a global approach to healthcare training, I commend the Board of Directors and the management of Auspan Hospital and Medical College for building both institutions. The hospital gives the students first-hand experience in the 10 courses. Indeed, the practical bit is what we have been looking for as a government to blend knowledge and skills for our students in the technical and vocational education and training centers, TVETs. That is what will carve learners to be more job creators, not seekers. Nimesikia wale wakisema wamepata kazi ya kutafuta kazi. As a registered TVET institution, Auspan Medical College therefore is a confirmation of your alignment with the government agenda of strengthening the middle-level colleges in response to market demands. On this note, I also commend you for seeking accreditation to offer degrees as a chartered university by 2026. We wish you well and look forward to celebrating this new milestone with you. Honorable guests, ladies and gentlemen, graduates, we hold this ceremony against the backdrop of COVID-19 and a sharp rise of mortalities related to non-communicable diseases like cancer, the third leading cause of death after infectious and cardiovascular diseases in Kenya. On the other hand, infectious diseases and injuries account for more than 50% mortalities, where non-communicable diseases contribute to at least 39.6% of deaths. Although COVID-19 rages on a smaller scale, we have learned that we need more medical practitioners, including researchers, if we must remain healthy despite the pandemics, epidemics, and other diseases. And as we move to economically transform the country, we recognize that a healthy nation is a wealthy nation. Honorable guests, ladies and gentlemen, graduates, Kenya cannot be a wealthy nation when our health facilities are dilapidated. Kenya cannot be a wealthy nation when we do not have enough skilled medical workforce. As of 2020, we had 189,000 health workers, 66% of them being in the public sector. At least 58% were nurses, 13% clinical officers, and 7% medical doctors. The World Health Organization recommends 25 nurses for every 10,000 people. We have 8.2 nurses serving 10,000 people. As a government, we have committed to transform the health system for quality, affordability, and accessibility as per the standards of the World Health Organization. That is why we have made it deliberate to work with the private sector and other actors to improve quality and access to healthcare services as conceived under the Kenya Health Policy 2014 to 2030 and the Kenya Kwanza Manifesto, the plan. We are also working with other actors to improve training to the highest attainable standards. Honorable guests, ladies and gentlemen, in this regard, our administration has prioritized investment in health. Progressively, we'll strive to increase the national annual budget allocation to 15% as per the Abuja Declaration by the African Union member states. We'll continue creating an enabling environment to encourage investment in health by the private sector to complement our efforts towards delivering universal health care as per our manifesto. That is why the graduates here today and those who will graduate from other institutions this year will be central as we roll the universal health coverage across the country. Reforming the NHIF system is also ongoing to ensure we cover everyone, including vulnerable groups like the old, people living with disabilities, among others. Honorable guests, ladies and gentlemen, graduates, Allow me to also recognize the critical role of county governments in delivering health services to the grassroots. As per our